is. But it's more of an indication that something might be actually going wrong within someone's body. It could be the back itself, it could be actually a certain body organ. So if you have back pain, specifically doesn't mean that basically maybe it's only the back that has the issue or the back structures, but also some of the organs could be having issues, and you're getting what we call like referred pain, which would actually portray within the back, and that's very, very common with the ladies. We shall come to that point. And
first, hold on. So you tried to explain that back pain could be a differential of other diagnoses.
Exactly.
Please ride on the discussion.
So everyone that has back pain, that's why we always tell people that before you rush to do anything you want to do, you need to first know what is the cause. That's where it's very, very important always visit a healthy care worker so that they are able to diagnose and tell you that this could be the cause of your pain. But back pain, basically we know a back has actually two parts. That's the lower back and upper back. However, the commonest back pain is low back pain, where at least we know that 40 to 60% of our general population have either once experienced back pain or are experiencing it at least. And so common between 30 years and above, given the aging and all that. But back pain is something that is caused by so many things or so many factors, depending on the age, depending on the nature of work someone does, but also depending on lifestyle experiences. So someone can experience back because of age, which is a result of degenerative diseases. We look at degenerative lumbar disease. This is a result of degeneration of lumbar, the bones that constitute the spine, that could cause back pain. We have disc problems. Maybe someone gets a disc prolapse. That could also cause back pain. That could be either lower or upper. Then we also go ahead to look at people get traumas, like accidents. And someone automatically, if they injure their back, they will have to get pain. Then we look at ladies, especially during pregnancy, a lot of things, physiological changes that happen, where we even look at that hormone relaxin that tends to make most of the joints mobile. Then you look at change of posture and all that. So they are most likely to get low back pain, but most especially low back. That also weakness of the abdominal muscles, which will also predispose them to getting low back pain. Then we go ahead and look at young kids also can actually have back pain, given depending on the nature of work and how they do their things. First of all, we've seen so many kids that actually carry very heavy bags, and that could actually be a predisposing factor for a young child to get low back pain or even upper back pain.
So, like from experience, in like 10 children, which age category are you looking at, and now how many have you gotten, for example, with back pain? But also parents, I think they pack lots of juices, lots of, you know, food stuff in the bag so that the kids can stay nutritionally upright. But
actually, would actually be happy if it was food and drinks, but most times most of the kids are actually carrying heavy bags with a lot of past papers, books, and those ones are too heavy. But ideally we're looking at the school-going children that are able to carry bags. Actually that's from like 7 years and above. And literally you see the nature of most of the kids that come with what we call like some of the spinal deformities, which is a result of poor posture because of carrying heavy bags. So ideally, we've seen so many that usually come. Most of the times when a child comes and they have like kyphosis, that is increased curvature of the upper of the thoracic region, or maybe sometimes scoliosis, the lateral curvature of the spine, which actually causes muscle imbalance, and the child will start complaining, I have back pain, I feel pain, I feel pain. But most times parents don't realize that it's actually the nature of the heavy bags they are carrying. Also looking at ladies, like I said, I want to tackle most of the things that most of our people don't usually give attention. Ladies who do high heels, a lot, that at high chances of getting low back pain, because first of all, high heels will change your center of gravity and tilt you, and then in a long run, you'll find that you'll attain increased curvature of the lumbar region, what we call lordosis, because you're trying to compensate to get the balance. But also note that it will also cause pain on the heel. Most times, most of them will always complain of that. So ladies whose lifestyle is more of putting on high heels, chances are high that they're most likely to get back pain. Not only that, we're looking at people who actually live a sedentary life. Let's say people who do office work. You've had a lot of office syndrome and all that. And not only office work, but the nature of your seat, if the back is not well supported, your feet are not resting well on ground, and also that will cause not only the lower back but also the upper back, where you have the pain in the neck, pain in the shoulder region and the thoracic region, because you're bending your head, you're on a computer, either phone or typing, and eventually as time goes on you start experiencing upper back pain, not just even the lower. And when you go ahead, you look at people who do lifting heavy things. I will look at people in the gym. Chances are high that people go and lift with poor posture, and chances of getting a disc prolapse are always high. Actually, those ones we usually receive. Yes.
Now, thank you so much for talking about gym. Now, gym is a hot discussion market because literally every person is in a gym club.
Yes.
As I speak, you must be in one club.
Exactly.
But of course, now I want to understand who should instruct people in a gym club. That's number one. Number two, how long should a person be in gym? Is it a long-term strategy, or it's supposed to be on your daily routine? Like, how long should a person be in a gymnastic club? Then lastly, how long per event should the person be in the exercise of the gym?
Usually it depends at the level of someone, first of all, intensity. For the beginners, you actually advise that the body adapts. The more you do, you keep on increasing what you call your endurance. So you have to start slowly. As you keep on improving, you also be able to know where you can go. Where we actually don't allow is someone to get to the gym and it's your first day, and then you want to pull and go at the same pace with people that have been in the gym for years. Yeah. So this is exercise, and first of all, you're dealing with your cardiovascular system. You're dealing with musculoskeletal of the muscles. So you build the endurance first of all. For muscles to endure more activity, you're building your endurance for the cardio, for the heart to be able to actually give the body needs. Remember, when you're doing the exercises, you're actually using oxygen, you're using glucose. Yeah. So at the person who has not been doing exercise and the person has been doing exercise, they have different levels of endurance. So first of all, what you usually do is listen to your body first. The things of push, I say it's not something that ideally we advise. So you have to listen to your body. Also, you also need to know your health. First of all, you need to know your BP, the blood pressure. You need to know if you're diabetic. You need to know all these first factors before you go for an exercise. Also, people who have like osteoarthritis, you also need to know that if you have osteoarthritis, this is something that is actually aggravated by more weight. So meaning if you're doing plyometrics, that exercise that require you to do jumping jacks, deep squats, it is going to worsen your condition. So you also need to know that that is not something you're supposed to do. So we advise people that to go to gym or to exercise places that have people that are trained, so that they are able to advise you accordingly. If you come with pain, they're able to tell you, with this kind of pain, we don't think you can do this. Maybe you need to go and get a doctor's clearance, because we know so many gyms actually that do that actually tell you, no, depending on how you are, you need to get a doctor's clearance so that you can come back and do exercise. Or sometimes we prescribe specific exercise they can do, and when they go there, they explain to them, and then they follow that kind of routine.
Okay.
Yeah. So, but also, first thing first is you need to go a place that has instructors that are qualified. Then you need also to know.
How do I identify like in this Uganda, in my environment where I stay, how can you identify that this gym has qualified people? Do I ask them a license? Ask them, can you have? Because yes, for healthcare, you can ask.
Yeah.
If you tell me a physiotherapist, I
Yes.
require a license. You can read me your number, even Google. So how can I do it?
There are actually a few that usually come and ask us, and we basically tell them. Then also, another thing is that most times before you even trust an instructor, a gym instructor, you need also to ask your physical therapist. They will be the ones to really guide you and tell you exactly what you need to do. And then when you go to certain gyms, the first day should be a day for you to see how things are done first. And when you take time and you really want to identify what's happening in certain environment, you'll be able to know that actually what they are doing here is not right or it's right. So I like people who really take extra time to do research. That's one. And if you do research, surely you really know this is the kind of place I need to go to, and this is the kind of place I need to avoid. Just like how they look for schools, how people look for schools, and even how they look for facilities, health facilities. It's the same way that you should be actually considering when you're looking for an exercise center that you need to go and start doing your exercises. And when you're not sure of what is being done, it's very, very okay to actually consult like a physical therapist. Because we have so many that can really help you out to know that this is the right place that I can go to for exercising.
Perfect. Thank you so much. I want us now to speak to the people who go to gyms.
Yes.
Like, for how long should a person be in a gym? Like, you know, WHO recommends 30 minutes exercise. But you find that you've been in gym, maybe most people go at 6 and they come back at 9 or 10. Or maybe at 8:30 or 9. And they tell you our instructor instructs us for 1 hour, maybe 2 hours. That's one. Another thing is, for how long should I be in a gym? Like, maybe I wanted my muscles maybe to be strong. I don't know, whatsoever the case. But now, how long should I be in gym? Like, will I finish 2 months, a quarter, 1 year, 2 years? When should I drop out from a gym?
First of all, I'll give you why gyms tend to be the best places for exercising. First of all, it's boring to exercise alone. Around people, there is more of group, we call it actually group exercise therapy. It has more of, first of all, giving you the morale to continue pushing. That's one. So it's going to the gym will not have a time where we need to reach and say, don't go. Because ideally we know that every person is supposed to be exercising. Yeah? So there is no time limit. However, we should look at how long should someone exercise on a specific day.
Yes.
That is as far as you can go. Listen to your body. That's one. Yeah? Listen to your body. Because someone may enter gym at 6 and they leave at 10, but when they have been getting breaks. That's why everyone should have an exercise program. Not just waking up in a day and just say, I'm going to the gym. Should be knowing,
my friend is going.
My friend is going. Should be knowing when I reach, I do some warm-ups, rest. I'm going to do some, heavy lifts a little bit and combine it with lifting, strengthening the muscles. Then from there, I'm going to go for cardio, and that's your routine, like 15, 30 minutes, and then rest 15, go ahead and that. And you know that each day I'm doing 1 hour or 1 hour and a half. But when you're a newcomer, you have to start with 30, go to 45, go to 60. As you go on, you realize it will be easy. And you can even go for 2 hours. That's how actually elite sports people do. It's through continuous training that you keep on getting better and better.
Perfect. Yeah. Thank you so much, Mr. Felix. For viewers who have just joined us, you are live on Google Data Vision Health and Beauty Program with me, Kamara Daniel. We are here every single Wednesday at 9 p.m. and bring to you different experts who demystify different health complexities around different conditions. And these are intended and tailored for you to consume and put into practice so that you can reduce the disease burden here in Uganda. We are still talking about back pain, but looking at the issue of how exercise has been misused and maybe misguided to the citizens. Now, we want to go to another misdiagnosis of back pain. Remember, we are still on that point.
Exactly. Now, we said that sometimes someone can have back pain, but when basically it's not the back that has problems. So because we know the anatomy of the back, it has...
we are talking about you have upper and lower back pain.
Upper lower back. And it has different structures, including the muscles, including the tendons and ligaments around there, including the nerves that are around there, include the spinal cord, but also the vertebral bones. So someone can, any of those, if they have a problem, someone can experience back pain. But they could be okay, but when someone has back pain, For example, if most of the ladies will actually go into their periods, and chances are high they're most likely to experience back pain. So, but that pain has to go away when the periods end. Secondly, if someone has issues maybe with kidney, you're most likely to get referred pain in the lower back. So that's where now we said that when you have back pain, you don't need to rush to go for treatment, self-treatment, self-medication, because you basically don't know the cause of your pain. And this is why most people think that back pain is so hard to treat, because most of the times they are not aware of what has actually caused that pain. So, like all we have said, all those organs, if they have issues, you could get back pain, but comes as referred pain. If they are treated, pain will go away. If you concentrate on treating the back, you're treating the wrong thing, because that's not the cause of the pain. Like we said, it's not a disease itself as back pain, but it's an indicator that something is wrong within our bodies. So that's where thorough investigations and physical assessments will be able to tell us what exactly is the problem. Now, upper back pain could be the lower upper. Someone has neck pain, which is the cervical region, and sometimes if someone has nerve impingement, they will start getting burning sensations, which what we call as radiculopathy in the fingers. Someone finds someone complaining, I have some sensations in the fingers, which as a result, either the muscles are tight, or maybe the compression comes directly from the spine. The same can happen with the lower back. But also with the lower back, apart from the knowing that muscles can be tight in our shoulders and the neck, muscles can also be tight in our glutes or the bums. We've all seen people who do wallets, people who sit a lot in poor chairs. It's what we call piriformis syndrome. So if the muscle beneath where the sciatic nerve passes gets so tight, it's most likely that it will compress sciatic nerve. And even when the back itself up is okay, but below it, the muscles down there are tight, they might cause compression of the sciatic nerve because of the tightness. And eventually someone will start feeling either pain down in the feet or burning sensations. So
because of the wallet?
Because of either wallet or sitting for long. Not even sitting for long, even standing for long. So someone will be like, what can we do? Or which is the best posture? Ideally, there is no good posture as long as you've maintained it for a long time. That's actually someone that needs to know. So all those things we've said could portray back pain, but now you need to do deeper assessment. Sometimes physical assessment that will tell, or go ahead and do radiographs, like X-ray, MRI, or CT scans, to be able to tell what is the cause. So that's mainly like generally for our people. But then we also look at, like I talked about ladies so much. Now, majority of the ladies will complain that every time, at least you will realize 7 out of like 10 who get pregnant, they will complain of back pain, and most especially the lower back pain. First of all, posture is very, very important in preventing back pain and also causing back pain. Poor posture is one of the causes for back pain, but here is a lady who has gotten pregnant and she has extra, size of the tummy, Not that the extra weight of the baby may not be significant, but the result of the posture she attains to attain balance. We know that most of the times they push their lower abdomen in front and the shoulders behind, yeah, to attain the balance. Same scenario we see with women who do high heels. It's almost the same scenario, but this one is maintaining it for 9 months. It doesn't stop from there, but also it goes ahead that there are so many hormonal changes taking place. And one of them we talked about significantly, the relaxin hormone, that makes most of the joints become mobile and flexible, which could cause hypermobility. Not only that, we're looking at the abdominal muscles being stretched. Weakness of the abdominal muscles, which actually work hand in hand with the lower back muscles, would cause pain.
Wow.
Or would cause the spine, because the spine is not fully supported, so it will cause pain.
Excellent. Yeah. We take a short quick break because there's a lot of information. When we return, we begin from pregnancy positions, related back pain. See you shortly.
Good Day TV, transforming your life.
Wayagala ebyuma ebirungi ebyogera basita pasiteri atunda nange ngoma n'eggita zonna basita pasiteri amplifier n'emizindalo basita pasiteri ebitala bya siteti ebyebika byonna basita pasiteri ebyuma bya ivetisi tubirina byonna basita pasiteri awunyudde wa sikirini tupangisa basita pasiteri ku kizimbe kya Newmark William Street basita pasiteri kati ndogendayo musajja mwesigwa kituufu endo gye gisoboka ekibanja mpola akikwata wagula ebyekkanisa jangu ewa pasita pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Essimu noti 782 00 84 ne noti 752 00 84 wano wokka we tusangibwa.
Good Day TV, transforming your life.
Thank you for being on Google Data Vision Health and Beauty program every Wednesday at 9 p.m. We are live streaming from Akafro Gospel Church at Saproka Road. It's where we are found. We invite you to our Christian programs every day, all the time, so that you can be part of our family. We are talking about back pain, and before we went to a short quick break, we were focusing on pregnancy-related back pain, and our expert was trying to explain how the position could lead but also prevent you. The reverse was true. So let's complete the statement for our viewers.
Yeah, so we said that all that weakness of the abdominal muscles, weakness of the pelvic, the joints, all that will actually cause, even weakness of the pelvic floor muscles, that will cause instability, first of all, in the lower back and the spine, and eventually someone will start experiencing low back pain. That's why the pregnant mothers will have either pain during pregnancy or even after. Yes, so it's very, very common, and usually that's the reason. Sometimes even goes ahead and you find that even experiencing what we said, like burning sensations down, which is a result of maybe disc movements or the disc prolapse. So it's so common. Sort of that you go to people who sit a lot, and I like to talk about them so much, because this has become the commonest cause now, apparently, of back pain. And initially, when we were in school, they would be like, people who are actually supposed to get back pain age is 40 and above.
Senior citizens.
Exactly. So apparently, you'll realize nowadays it's actually below 40. The clinic will be full of young. So it's either lower back or upper back. And this comes to the posture. How we sit. We sit for so long. You come in the office at 6, you sit, you work during the day, you're not doing anything. You get out of the office in the next day, in the evening, you go to your car, drive, reach home, shower, watch TV, sleep, same routine. Now the scenario is here that, like we said, most of the times why back pain can be tricky is at times it's not well diagnosed. For example, it's not all the time you have pain. It's because the bones or the spinal bones or the vertebral bones have issues. At times, it's the muscles being tight and tensed up. Now, when you sit for long, like how we sit, in most cases, you're seated, but the hip flexors get tight because you are in this position at 90. And most times when they get tight, tension builds up, they start pulling, and there is muscle imbalance in the lower back, and eventually someone will start feeling pain. You sit for just a short time, eventually you could sit for 6 hours, now it gets to 2 hours, it reduces to 1 hour, it moves now to 30 minutes. You sit for 30 minutes, you start feeling the pain. Because muscles have been tensed up and they are tight, they are no longer in a position to hold you in that upright position for long. Because when they act for some time, they get, tight very fast, and eventually pain because of inflammation. So if they shorten the same scenario because of oversitting, this is why, because our bodies were made not to be in one position for long. You're supposed to be moving, you're supposed to be stretching them. So where someone experiences that, they need to know it could be their chair. It could be actually be causing issues. It could be their bed at times. Some of us, we have our beds, our mattresses, where you sit, you sleep, and then it makes a folding. So the fold...
A hole.
A hole. So that hole, eventually, it will alter the nature of the spine. And when the nature of the spine is altered, eventually, like I said, there will be muscle imbalances, sometimes tightness, and eventually you sleep for 1 hour, you can't stay in your bed, it's painful. You shift and start sleeping down. And you don't ask yourself, why is down a bit more comfortable, yet it's hard? Because down maintains your spinal alignment. But up on the bed, it's a different story. So these are small things that our people don't pay attention to. And when you come for treatment, usually, it's the physical assessment that will actually rule out. The reason why we tell people that don't rush to go and take x-rays, because at times they're not necessary. You need to go to a health care worker, be able to assess you, be able to do physical assessment, and then do x-ray as a differential diagnosis to know whether it's the bones, whether it's the muscles, whether it's the spasms that are actually, straightening the spine and all that.
So I was about to ask now, which kind of mattresses are you recommending?
To be very specific, high-density mattresses are better. I know majority usually rush for orthopedic mattresses. They are also there, but that's usually the last, like the real last recommendation of a mattress for someone with low back pain. But high-density mattresses will give you a better feel because, first of all, it's not too hard, but also not too soft. So it maintains the spine alignment. Good quality, of course. We know sometimes you may land in poor quality, but good quality would actually give you the best.
Wow, thank you so much, Mr. Felix. I think next time we should carry a mattress here and then we show our viewers which mattresses should they buy. Very important discussion. So now, of course, we want to explore now the prevention strategies. How best do you prevent the back-related pain? Across age groups, you're going to give us the prevention strategies per age category, beginning with young children that you talked about, and then maybe treatment modality is available, and we need to look at some of the myths related to back pain.
Exactly.
Or we should begin with the myths before we go to
Probably,
prevention.
maybe. There are so many myths, and I'm sure the commonest one everyone knows. I've always had questions where they ask me that, is it true that the non-marrieds, people who are not married, usually get low back pain? And if you take long without meeting your partner, you may have issues with your back. The right answer is no. It's not true.
But is it true according to?
It's according to. Now, when we say according to research, all the things we've mentioned that cause back pain, not having time with your partner is not one of the causes. However, I know people have coincidentally had back pain and went and met their partners and things came out well. They say, pain has reduced. Oh, my back now is okay. Now here is the scenario. Like we said, back pain could be caused as a result of tight muscles. And the activity that we've mentioned can actually be as part of a strenuous exercise, which could give a relief of the muscles. But that doesn't mean it does necessarily treat the pain. So that's why our people need to understand that actually that could actually worsen your pain if you don't know the cause of your pain and you're actually going for it. So yeah, our people need to know that.
Okay.
Going to how our children, we've looked at, first of all, the cause, and we looked at posture, maybe children lifting heavy bags, and all that, sitting for long. We need to make our children active. We need to give them at least, we need to avoid giving them heavy bags. If we're giving them bags, they should be backpacks where all the arms are actually within the bag, not just one side, carrying a bag on one
I like that.
Yes, so it not just one side. So we also need to pay attention to, because sometimes they may get injuries and so that's why they're experiencing pain. So we need to pay attention to our children, be able to take them for assessment in case they are complaining of pain. Looking at the adults, now we looked at the back pain that is caused as a result of degenerative diseases because of age, arthritis, so that at times we need to look at nutrition. Nutrition is very, very important. Yes, nutrition is very important. We look at also they need to be going for routine back therapy to maintain, not just wait when pain comes and then they need to come for treatment. It's also then you need to avoid activities that influence them to do a lot of bending. So we know that most of our people like direct bending where you're doing like back flexion directly. We advise people that if you're picking something down, bend your knees. If your knees are not bent, your back is not safe. If you're picking something down, if the knees are not bent, your back is not safe. If they are lying down, they don't need to come directly straight, especially if they're lying on their back. They need to turn on the side and be able to sit. There you're not putting direct strain on the spine. That's for the elderly. Then we are looking at the general age group, the active group. Exercise is not something you need to go away from, but guided exercises. Yes, especially for the back. You need back therapy, but back therapy is done after assessment because you might be having back pain, but you're contraindicated to certain type of exercises that those exercises may worsen your condition. That's why you need to look for a physio to guide you and tell you, you do this, you do that, you do that. That will prepare you for another level of exercise. Posture is very important. Let's have our offices, especially people who are actually in the corporate club. We usually do what we call office assessments. So you need to do ergonomics training for your staff, train them on how to sit well. You need to run things on, assess your office. Is this chair or the seat you have the right seat? Does it have backrest? Does it have enough support? Is your computer well arranged? to be able to actually not cause neck pain and shoulder pains. Those are small things that our people don't look at, but it's actually causing issues, and it's actually a healthy hazard, by the way. So all that ergonomic trainings, it's very important, should be done. Then also, if you feel back pain and you've been using high heels, for ladies, they need to avoid. For pregnant women, we actually recommend antenatal physio. Among the antenatal package, we recommend antenatal physiotherapy. That when you're pregnant, you add antenatal physio, because there are exercises we do when you're pregnant, even after. So that will actually help you to go through your pregnancy without any back issue, and also prevent the post of when actually prevent you from getting back pain even when you have delivered your baby so well. Yeah.
Perfect. Thank you so much for giving us many preventive strategies that each person has gotten their own, one way or another, to begin with, about preventing back pain. Let's explore treatment strategies that are available. Do you have any direct treatments for back pain?
Yeah. First of all, back pain treatment, there's so many, and every treatment is defined depending on the cause after the assessment, like I said. And one of them is if someone has muscles, the cause is because of muscle are tight and all that, then physical therapy or physiotherapy would be the first treatment. In that, we have so many modalities that would be used, like heat therapy, infrared therapy, that will relax the muscles. You go ahead and do soft tissue manipulations, commonly known what we term as massage. Those are the soft tissue to relax the muscles. Then go ahead and after all that, because sometimes the muscles are weak, the abdominal muscles are weak, so you need to strengthen the cores. So it's exercise therapy. And at times when someone has those like nerve compression and all that, tractions is done to relieve the compression. You go ahead and use TENS machine to stimulate the muscles. That's all the package of physio. And of course, going ahead and train the preventive factor that we talked about, the posture and the ergonomics. Sometimes someone has inflammation, so you go ahead and there's medication, anti-inflammatories. If someone has nerve compression, of course they will need to have nerve regenerators. Yes, so more extra supplements, because of, like, you take a degenerative disease, you need to have calcium supplements. You need to have those that joint supplements that will improve on chondroitin. But then when it's too severe, someone may actually even go for surgery, like for those decompression surgeries for the spine. So many treatments are there for back pain, but they will also depend on the cause. Yes.
Perfect. Thank you so much, Mr. Felix. Our viewers want to thank you and want to once again encourage you to visit our social media platforms, Greater Vision Uganda, Facebook, TikTok, LinkedIn, and X, so that you can have this conversation first thing, but also put in your comment, your experience, and what you have heard about back pain or what you've been experiencing from wherever you've been watching us from. We want to thank you and encourage you to not leave Health and Beauty program every Wednesday at 9 p.m. and of course where learning is brought closer to your room. Now, Mr. Felix, in order to conclude this very important program, I'd like to hear your last learning remarks. What could be your last message to the viewers of Google Data Vision regarding back pain in general?
I would actually say that every one of us is prone to get back pain. At some point you'll have the pain, but don't normalize the pain. There's nothing like normal pain. Someone saying that, for me, I've been this pain, it's normal to me. No, there's nothing like normal pain. So when you get pain, whether you're a healthy worker or any other person, please look for a healthy worker. Could be a physical therapist, a physiotherapist, or any person in a qualified health setup that will be able to assess you, and then your treatment will be designed according to the cause, and back pain is treatable. Yes.
Perfect. Now, thank you so much, Mr. Felix. Should you have any greetings? Please say them.
I send my greetings to all my people who actually follow PT Felix, and my friends and family. Yeah. I love them so much, and I wish them well. Yeah. Surely.
The fact that
Yes.
you're not singling any person
I
out,
know.
and I'm certain that they'll be able to receive the greetings. But of course, we want to thank you for being with us when we started this program at 8 p.m. till now. And of course, we want to once again thank you and encourage you to always be on Google Data Vision. Share to your friends so that they can learn more about back pain. But keep on the social media platforms, Greater Vision Uganda, Facebook, TikTok, Twitter, and LinkedIn for you to learn more about health and well-being here with us at Health and Beauty program. I am Kamara Daniel. I hope to see you next week, Wednesday. Take care of yourselves. God bless you.